Monkeypox, a disease that was discovered in 1953 and is caused by the monkeypox virus. Welcome to Focus on Health, a show on all matters health, wellness, and lifestyle. And on today's episode, we discuss monkeypox alongside Dr. Najib Nizar from the Equity Afya Center, Ruru 2. But before then, take a look at the health updates. Very informative health updates right there. And like we said, we are discussing monkeypox alongside Dr. Najib Nazir. Take a look. So maybe, Doctor, you can introduce yourself to the audience.
So my name is Dr. Najib Nizar. I'm a medical officer who has started working with KUTV recently, and we just opened a new branch. I studied in Kenya Methodist University. I did my internship in Nyeri Public General Hospital, worked at Medihill for some months, and now here I am.
Okay, so the topic of the day is monkeypox. What exactly is monkeypox?
Monkeypox is a viral infection that is usually spread by, there are two types of spreads. One is animal to animal spread, and the other one is animal to human spread. It is a viral infection that usually has symptoms of fever, a rash, lymphadenopathy, and the rash is of a vesicular kind. It has fluids and it has a central umbilication in it. So currently we refer to monkeypox as mpox because of the stigma that was associated with monkeys. So they decided to rename it mpox. Then we also have had currently we have had three confirmed cases, and we have had 29 suspected cases as of 6 days ago. Yeah.
So how is it exactly transmitted from animals to humans?
So number one, the animals that transmit this virus include bushmeat. So the bushmeats that the animals that are considered bushmeat include monkeys, they include prairie dogs, they include rats, they include they include also other animals such as gazelles. Yeah. So these are even the squirrels. These are the hosts that have been known to be natural reservoirs, meaning they have the virus in their body without any symptoms, and they have natural antibodies against it. So when someone ingests those uncooked or raw meat from those type of animals, then they can easily be inoculated with the virus. Number two, having contact with those animals. So for example, like let's say you have imported a dog from West Africa or from Central Africa, then the dog has the prairie dog, they have like the manifestations of the monkeypox, such as the fever, the rhinorrhea, they also tend to have lymphadenopathy. So they can spread that, like when you contact their saliva, when you get in touch with their saliva or with their feces and all that, like fluids in general, they can spread it to you. It can be inoculated. Sometimes even the contact with lesions, like for example the rash that is there, when you can touch it, and you can easily inoculate it to you.
Okay, so is it a novel virus?
It is not a novel virus. So it was discovered in 1958 in monkeys in Denmark. Then nothing happened. In 1971, when we were having the eradication of smallpox, the people in DRC, the WHO that was based in DRC, they noticed a 9-year-old boy who developed similar features to smallpox. So when they did the investigations, they found out it was monkeypox. So we have had it for long, 1971. Then we also had a 1997 outbreak again in Zaire, which is the DRC. Even the 1971 case was in DRC. So So in 1997 we had an outbreak there. In 2003 we had an outbreak in US, and in 2022 we had one in UK. Right now we are having one in Kenya. Yeah.
Okay, so you've also mentioned that it is caused by eating bushmeat, and we also know that Ebola is also caused by eating bushmeat. Could you tell us the difference between the two?
So monkeypox does not have hemorrhagic fever. So Ebola, most of the time, when you have Ebola, you will notice that you are having bleeding from your orifices, so including the mouth, the anal region, from your blisters. You see, but in monkeypox, it is a milder form. It's even milder than smallpox, by the way, because there is some studies that have been done showing that people who had been vaccinated for smallpox with the vaccinia virus, with the vaccinia immunoglobulin, actually they had milder forms. So Ebola is more serious than monkeypox. It's also caused by bushmeat, yes, but you have that hemorrhagic fever that monkeypox does not have.
Okay, and is monkeypox as fatal as Ebola?
No, Ebola is more fatal. Yeah.
Okay, so in terms of fatality, is it in terms of maybe the numbers? Does monkeypox cause death?
Monkeypox, so far in Kenya, it has not caused any death. All of our patients have recovered. We had one in Taita, we had one Taita Taveta County, we had another one in Busia. The third case was in Nairobi, so they have been isolated. So far, no mortality, but from the studies that have been done, it has been known that African population has had a mortality of up to 10%. Yeah, from the previous outbreaks that we have, especially the 1997 outbreak. Yeah.
We've all seen the lesions that monkeypox causes, and most likely people are going to say, maybe it's just chickenpox, especially when they see it in children. Could you tell us the difference between the two?
So first of all, the type of the rash. So the rash of monkeypox, usually it begins from the face. From the face, it then spreads downwards. So we call it craniocordial spread, and usually they have different types of lesions that you'll have. So number one, you can have a pustule, which is pus-filled small papules. You can also have vesicles that are blisters. In layman's term, they're blisters. Then you can also have macules. So in monkeypox, usually you will have that same type of lesion throughout the body. So for example, like you'll have macules, papules, all of them are the same. You see, number one, they are starting craniocordially. Then for the chickenpox, usually most of the time it's fluid-filled blisters. So we call them vesicles. Anything that is fluid filled, we call it vesicle. So the vesicles usually they start from the chest, face, then they spread to the rest of the body, and most of the time they spread to the rest of the body, including the genitals also. See, then chickenpox, most of the time it's itchy. Smallpox is not itchy. Also the progression of the rash. So monkeypox, the mpox, most of the time it's slow. That's why you tend to have same types of the lesions throughout the body, because it's slow. For chickenpox, it's rapid. Yeah. And also we can also differentiate it with smallpox, whereby smallpox will have Koplik spots. So usually they start from the tongue and the mouth, and they spread small red petechiae or pustules. They spread throughout the rest of the body. Yeah.
So I think the main public health concern right now is human to human transmission. Could you tell us a bit more about that?
So human to human transmission, the monkeypox, the mpox is being spread. It can be spread via respiratory droplets, so it's advisable you wear a mask. It can also be spread via contact with the lesions. So for example, if you have a cut, if you have a scratch, and then you touch that lesion without protective equipment, you can get that infection. You can also spread it sexually. So like most studies have been done showing that men having sex with men have presented with the monkeypox that is only anogenital. So like from the penis and the anus, you will find those lesions there, like they're focused there. So we do say it's also sexually transmitted. Yeah.
And is it as rapidly transmissible as COVID?
Yes, it is. Yeah. Because of the respiratory inoculation, it is as rapidly transmissible as COVID, but the complications of bronchopneumonia are a bit less. Like, yes, there are the complications that are there, but most of the time the complications are skin manifestations.
We're taking a short commercial break. Don't touch that dial. We'll be right back. But before then, take a look at the Did You Know segment. Welcome back to Focus on Health. We are continuing the conversation on monkeypox alongside Dr. Najib Nazir. Take a look. Maybe, Doctor, you can emphasize on other signs and symptoms other than the rash.
Yes, so usually we'll start with the symptoms because it's easier to identify for the patient. So we'll have a fever. Most of the time, mpox, the fever is ranging around 38 to 39 degrees, which is a bit less severe than the smallpox, which is up to 40. Then we can have a rash, like I mentioned before, and I explained it before. We can also have lymphadenopathy. So that is for those who are the audience who are not doctors, that is when you have swellings on the neck and they are painful swelling. It's painful swelling. So for us, that is actually one of the most sensitive signs for monkeypox, like to differentiate monkeypox from smallpox and chickenpox, you will have lymphadenopathy, yes, in monkeypox. So the other signs and symptoms include a sore throat, a backache. Some of them also present with stomachache, a runny nose, cough, coryza, which is like a sick feeling with fever and malaise and fatigue. So essentially just like any other virus that will present with the flu. Yeah.
Okay, so at what point should an individual seek medical attention? Because they'll be like, I've ever had these symptoms, it might be a flu. So when should they come to the doctor?
So monkeypox is, generally speaking, it's self-limiting. So our body fights it on its own within 2 to 4 weeks. So there are some patients who will present with sore throat. Others they'll present with the fever, the fatigue, and all that. Yes, the moment if you have fever and you have like coryza and like coryza, like I said, fatigue, malaise, body joints, it's good you go to a doctor. If people are not willing to go to the doctor, then the moment the rash comes out, then that is your time to go to the doctor. But in Kenya, most of us we seek treatment when you get the body joints. Yeah, so it's advisable when you get the body joints, you just come because the supportive management that we usually give, like painkillers and lozenges, they help with the symptoms, and the body might resolve the viral infection in its own. Yeah.
You've mentioned coryza. What is coryza?
Coryza is a general term that is used in viral infections, whereby you have fever, you have joint pains, you have body aches, and malaise and fatigue. Yeah, so it's a term that is used broad spectrum.
Okay, so you've also mentioned that monkeypox is self-limiting. So shouldn't everyone just aim to get it because they're going to get the immunity anyway?
There is something called herd immunity. Especially it was noticed in smallpox. When people are getting vaccinated for smallpox, there was herd immunity. So it's, yes, there might be any viral infection usually has a herd immunity, including even the influenza outbreak in 1920. So I wouldn't advise you to go look for it, but you will get it to once in a while. You might not even have known. You might have not even known that you got it, and maybe you got the immunity. Yeah, but there are some populations that are at risk. I think I failed to mention that. So we classify them. So there are people who are immunocompromised, people who are pregnant, breastfeeding, diabetic, cancer patients, people living with HIV, children less than 18 years. That's the first class of immunocompromised patients. The second class is healthcare workers, so people who are working in KEMRI, people who are working in the level 6 labs, people who are doing screening like outpatient doctors and clinical clinicians. These ones, they are also at prone to getting the monkeypox infection. The number third class is men having sex with men, and the number fourth class is people who are in refugee camps, because of the fact that it spreads via respiratory droplets and hygiene is poor there, so you cannot be sanitizing. A side note about age, the reason why pediatric population is affected more than the rest of the population is because of the fact that smallpox virus, the vaccination that was given, the vaccine that was given, actually it helps reduce the signs and symptoms of monkeypox. So there is some immunity that was conferred by the vaccination because of the fact that they're from the same class. Yeah. So since smallpox was eradicated in 1971, people stopped vaccinating for smallpox. So you'll find that the elderly actually have better immunity than the children.
Okay. So you've also mentioned that you can fail to know that you have monkeypox. Does this mean that the lesions on the skin may fail to appear, but you still have monkeypox?
You see, we have different stages of monkeypox. So there is the prodromal phase. The prodromal phase is just like any other viral infection. So you'll have fever, rash, lymphadenopathy. Then you have the exanthem phase, where the rash comes. Now, by the time the rash is coming about it, you're already like halfway through the disease, the natural progression of the disease. You see, so when the rash comes about, of course, you'll go to the doctor. The doctor might prescribe for you emollients, antihistamines, and sometimes even antiviral infection medications. We'll get there. But the rash usually comes after almost like up to 14 days after you have been inoculated with the virus. Yeah. So, yes, the body is fighting it on its own, but the moment you have the rash, you will go to the doctor.
For cosmetic purposes, especially for the ladies, of course, we do not want to have lesions on our skin. Do they completely clear from the skin?
So the complications, the most common complication of monkeypox, mpox, is scarring, just like chickenpox. So, but the good thing is we do have anti-scarring creams that are available that can clear the scarring. For cosmetic purposes, yes, there is some medication to help clear.
Okay, so clinically, I think we all know that the lesions are one of the most common ways that the diagnosis is made. Other than that, how else is diagnosis made?
So there are like 4 methods you can use to diagnose. The first one is taking a culture of the nasopharyngeal or the oropharyngeal swab, just like we used to do in COVID, the painful one that people refuse to do. We can do that viral culture. If it's positive, then actually there is a criteria, a diagnostic criteria from CDC 2022 that says, number 1, you should have either one of. So the first one is the culture. The viral culture should be positive for the nasopharyngeal swab. The second one is you can do DNA PCR from the lesions. Number 3, you can do histoimmunochemical tests. Number 4, you can do a slide. It's called a zinc smear. I don't know whether you've heard about that. A zinc smear. But the problem with the zinc smear is it does not help you differentiate between the rest of the viruses. So you just know it's a virus, but you don't know which one. Yeah. So, but the most common site where doctors prefer to do the testing is scraping of the lesions. You just, either if there is any pus, you just put a swab and inoculate the virus, or if the lesion is not weeping, then you can just cut it, like you can scrape it, and you send it for DNA PCR.
You've also mentioned that it is sexually transmitted. Does that mean that barrier methods such as use of condoms prevent it?
Actually, they do help prevent it in terms of bodily contact. So, for example, if the male is having a sex with a female, and if the male is inoculated, at least if the virus is being shed through via sperm, then we can prevent that. But there's also the issue of mucocutaneous contact, and with like, for example, if you have a rash on the base of the penis or at the opening of the vagina, of the vulva, sorry, then if you get a cut and you get in contact with that wound, like that blister, and that blister is shedding, it can spread. Yeah.
Okay, and how is management for mpox?
So management, we do supportive and antivirals. Prevention is also part of management, so 3-pronged. So the supportive, we usually give antihistamines, we give an emollient. There is no role of zinc oxide, so creams such as Norash, they are not indicated. But we do have emollients that are soothing for the itchiness and the disturbances. Then we do antivirals. So there are different classes of antivirals. We have tecovirimat, which is it's abbreviated TPOXX. Usually it's based on kgs, so we can do 600 milligrams twice a day. For adults, and for children, at least we have to have the children being greater than 13 kgs, and we use it at mgs per kgs. Then we have cidofovir. Cidofovir has been known to be used for cytomegalovirus retinitis, so we can use that. And we also have cidofovir, the third drug. Then we have something called ocular mpox, whereby when you have the rash from the face downwards, you touch it, you touch your eyes, it can inoculate in your eyes. So the moment you have features such as keratitis, which is inflammation of the eye, you can have eye discharge, you have pustules on the eye, and it's you can correlate it with the rash on the body. It's recommended we start trifluridine ointment. Yeah.
Oh, so that's the end of the management. Is there any supportive, like oxygen, maybe?
No, you see now, those are, you have to manage the complications also. So for each complication, there is a management. Like, for example, the number one complication is scarring. So there are anti-scarring creams that are available. You can have bronchopneumonia. So for the bronchopneumonia now, usually we say, like, if the patient is the clinically stable, like, do they have SpO2 less than 90? Are they confused? Are they having respiratory distress? Is their BP hypotensive? So the CAP 65 criteria for admission to ICU, we use that now. For example, if someone is having a complication of mpox, that is bronchopneumonia, we will manage it in ICU with oxygen, antibiotics, intubation, and all that. Yeah. So each complication has its management. Others include keratitis. You can have abscesses. So, like, someone who has been itching, who has been scratching himself, and then they cut through the wound, and they can spread it to other places. So the inoculation that happens there, sometimes it might even require drainage. Yeah.
Okay, So you've also mentioned scarring, and especially, the eye is very sensitive. Is there a potential for blindness when it comes to scarring?
There is a potential, especially if it's one of the complications of ocular mpox, blindness, especially if it's not detected early. Yeah.
Okay. So maybe you can mention, how do we prevent this?
So prevention measures, we advise you wear a mask to prevent respiratory spread. You avoid contact with lesions. You avoid taking bushmeat. So I know we Kenyans are civilized, but nimeona I've seen some rabbit being sold in Naivas, so just avoid rabbit for now. Yeah. So actually, foods like meat like rabbits, rats, squirrels, monkeys, gazelles. Yeah, we have to avoid for now. Then we also have to, us as clinicians, you have to wear protective equipment. So not just the mask, including gloves. You make sure you're not touching the lesions without the 5 steps that we know: before touching something we sanitize, after touching something we sanitize, in between a procedure we sanitize. Yes, the 5 steps, the 5 moments that are there, we have to practice them religiously. Then we also have to avoid contact sexually, so protection actually does help in some aspect. We can also, vaccination also is part of prevention. So there are 2 vaccines. I don't think they're here in Kenya yet, but we are working on it. The Ministry of Health is working on it. There is one that is called the GNOS. It's very hard to pronounce, GNOS, and that is the monkeypox virus vaccine. And we have another one called ACAM 2000. That used to be the smallpox vaccine. So the GNOS we give 28 days apart, and ACAM 2000 is just once. There is no inferiority. There was a study done that showed both of them are equal, like there's no inferiority or superiority, like there's no preference right now. You can use whichever you want. Yeah.
Is there a rule for hand washing?
Yes.
Okay.
There is a rule for hand washing, sanitizing. I was talking about the 5 moments.
Okay.
That's part of hand washing. It's very important to do hand washing, and try as much as we can to prevent touching surfaces and all that without being sanitized.
Okay. So do you consider, or would you emphasize people putting on mask right now?
It's advisable to use masks right now because it is being spread by respiratory droplets.
You could tell us the role of international travel when it comes to the spread of mpox.
So right now, we have US has banned our importation of pets because they realize that there are some countries that import and export animals. So they have a ban on prairie dogs, and also that's to avoid the spread of mpox. They had actually considered lifting the ban, but it's still in place. Then also for humans also, like it's recommended if you go to an international flight, international travel, at least when you are coming back to your country, self-isolate for at least 14 days to be safe.
Very informative conversation we've just had, and just as Dr. Najib has emphasized, observe hygiene and sanitation. I have been your host, Joy Bofenda, and until next time, stay safe, stay healthy, and live with the Healthy You segment.